So it seems to me that chemical peels are kind of making a comeback.
Mm-hmm. They are. Thank God. Thank God. Yes. Thank God.
And we found an amazing peel line.
We did.
That causes no inflammation when they get the peel. So this is something people can actually do going into the summer months without that downtime risk or the sunscreen risk or the hot tub risk.
And melasma.
Yes.
Melasma is more and more of a concern for a lot of people. So these peels are great for that. Linder Health is essentially what the peel line is. And Dr. Jennifer Linder, who is a dermatologist and a Mohs surgeon, actually, developed the line. And she really wanted to develop a peel system that was very tailored, that you could actually use those different categories of peels depending on what we're dealing with. Because you could have someone walk in that has sun damage, forehead, cheeks, but has breakouts on their chin and has rosacea on their nose.
Right.
Okay. Not an uncommon thing.
Right.
It's a reality. So with this peel system, we can really customize that peel experience and put a hero where the sun damage is, and we can put the spot where the acneic area is, and then we can treat that nose with the polite peel, which is specifically designed for rosacea in sensitive patients. And so I really love the fact that I can tailor, and it's not like I'm slapping one peel on them and being like, oh God, I hope the rosacea doesn't flare up from this.
Right.
And so I can really tailor that peel to the different areas of concerns. It's also great for summer because you're not peeling like a snake. There's no prep that's needed. There's no downtime.
Right. You can lay here and go to your yoga class.
And that's absolutely huge as well, because for years and years and years, the old school way of thinking is that, okay, great, let's do this, let's schedule it. You got 7 to 10 days of peeling like a snake. We have to put you on all of these creams to prep your skin in order to even tolerate the peel. And so the fact that, we know now with science and with evolution and with everything else that she actually developed a non-inflammatory peel line is super exciting.
It is. And because it is non-inflammatory and it's just targeting those zombie cells, we can be a little more aggressive with layering too.
Correct. Yeah.
Without causing all that damage to the healthy tissue.
Right.
We're just really targeting those cells that are no longer cell replicating.
Right. And it's awesome that I can tell people, no, you're going to have light flaking. You can go on about your life. Like you don't have to hide in a cave and
cry
for 7 to 10 days and be like, oh my God, is this going to get better? You're good to go. You're really good to go. And as long as you wear sunscreen, which everyone should be, you're fine. And so it's a great way, because in the summertime, you're limited on what you can do, right?
Absolutely, yes.
You can't do you can do an IPL, but who doesn't want to get some sunlight in Wisconsin when it's only nice for 4 or 5 months out of the year?
Right.
So we do have the option of continuing that skin health and continuing those treatments to make sure that we're, maintaining and brightening and doing all of the things, and we don't have to worry about stopping our lives, and we can enjoy our lives, get a peel, and go on about our business.
Yeah. And to that point, most people look amazing after the chemical peel.
Yeah.
I would say that on maybe day 3, you look a little bit flaky and dandruffy around, but most people leave here looking really beautiful. Like you could do this peel before you went to a party. Yeah,
absolutely. And the peeling is very light.
Yeah.
It's not like sheaths of skin coming off. Yes. And that's just easier to deal with as well.
So. And it doesn't hurt.
And it doesn't
the
hurt.
Old school peels that you're on there crying and waiting for it to be over.
Yeah. And I think that's also another fear, like, oh my God, is this going to burn? Is this going to feel like I have a grill on my face?
Right.
It doesn't.
Yeah.
It doesn't. And so I just love the fact that I can tailor the peel depending what I'm dealing with.
Right.
And no person is the same. And so that's great that she came up with 3 different options that can be used in conjunction. It's not going to, I could do a hero all over, and then if I see that they're getting a little bit of inflammation, I can apply that polite, and it calms it right down.
Yeah.
So I really have loved working with it, and I'm super excited about it.
That's great. So talk to me about the difference between if somebody wants to come in just for a peel versus like a peel series.
So one peel isn't going to do it. hate to tell you,
Darn it.
this is.
I was really
it's-
hoping you were going to
it's-
say one and done.
If it's too good to be true, it usually is.
Right, exactly.
It's just
I'm
not
teasing.
possible.
Yeah,
Not possible. So a series is always recommended. I like to use analogies, and I've said this many times before. If I'm exercising once a month or once every 3 months versus if I'm doing it on a regular basis and I'm incorporating different things, I'm going to get a bigger benefit.
Of course.
And it just is what it is. Sorry, I can't lie to you. It's one treatment is not going to do it. You have to kind of put in the work and you have to be committed to it. But once you start to see the results, I think it's easier for people to be like, to invest in themselves.
Yeah.
To be like, okay, I know this is working. I'm seeing a difference. I look in the mirror, I feel better. I'm more refreshed. I'm brighter. And so it just becomes easier, I think, to commit to that once you start to see results.
So I know it's really customizable and I know everyone is different,
Yeah.
but just to kind of give me some blanket ideas of how many peels you'd recommend and kind of what the timing would look like.
So typically, if I'm dealing with, let's just say I'm dealing with texture, I'm dealing with the classic sunspots, texture, aging. You're going to come in for the consultation. We're going to go over everything. I like to get you in my chair, get those products on you, smell them, feel them. Do you like them? Everyone's different as far as what consistency they like too. So what I never do is want someone to buy something that's going to go into a cabinet and sit there.
Right.
Because we already all have all of those things in our cabinets.
Right.
I don't, but a lot of people do. But I want to be honest. I want to educate them. And a series of at least three to four. And they have to purchase and do their maintenance at home. And they have to work with me.
Sure.
They have to work with me. That just is what it is. Even if it's buying an active and a sunscreen and a good cleanser or whatever the case may be, even if you want to implement certain products, you got to kind of put in the work and you have to do your own diligence at home as well.
Well, they're with their skin every day,
Yes.
all month. You get to see them once a month, once every other week, whatever the protocol is.
Right. Initially, I like to see people at least at like a 2 to 3 week mark just to see how their skin is doing. It takes 15 minutes. Again, I'm here to help people. I'm here to guide them. I'm here to build that trust with you. And so I'm fine with people coming in at a 2 week mark, even if I'm implementing a different product. If it's a phone call, if it's a Zoom, hey, how's it going? How is this working for you? Any problems, any questions, any concerns? That's what I'm here for.
Yeah.
So,
And you're great at it. Thanks for being here.
Thank you. I love being here.
Yay! I'm so happy.